Good morning, Integrity family. I am so excited to be with you this morning for our fall live stream. You are in the right place at the right time, and we are going to have a lot of fun today talking about one of my favorite topics, chiropractic beyond pain, right? This is a really important message, so I'm so glad you're going to join us today here for the next 30 minutes or so and dig in on this topic. So first of all, I want to start with what is chiropractic. You've all seen these famous quotes. You all know what they say. But the idea, as you know, is that chiropractic is a natural healing. Chiropractic is different from medicine. And chiropractic is beyond just fixing something or masking something. It is to give care for the human frame, for diet, and the cause and prevention of disease. Right? In addition, the definition by the World Chiropractic Federation and the ACA are very similar, as you can see here. But again, the biggest thing that we are going to hone in on today, and I really want to get the message across, is that chiropractic is not just about giving an adjustment to get rid of pain. Both of these definitions and the ones we just talked about are very clear. It is to impact the general health of the patient. Both of these definitions, very important. Chiropractic is not just to get away from or get someone out of pain, but it is for our general health. So, when we talk about chiropractic wellness, we know that we have barriers. We've talked about these all the time in coaching. Specifically, Dr. Doug laid out these 5 barriers in one of his previous conference classes. If you haven't seen it, you're going to want to go back and watch it. But what are these 5 barriers? Well, medicine 2.0. We'll talk a little bit more about that in a second. 16% utilization and stagnant. So we went from 8% to 16%, excuse me, and then we've stayed at 16% for years and years and years, and it's just not changing. We're not tipping that needle just yet. We have fewer opportunities to talk about chiropractic wellness. If your patients come in an average of twice a month for a wellness adjustment, you get 0.002% of the minutes they have in a month to talk chiropractic wellness. That's it. And the rest of the time, they're inundated with the medicine 2.0 message, right? And then we have distractions, whether it's TikTok trends, Facebook ads, scary videos, or things they can buy like a neck contraption or whatever else. There's distractions that pull people away from the message that a chiropractic adjustment is what they need for wellness care. And then the last one is friendly versus friend, right? Are you talking weekends versus wellness with your patients? Are you importantly, it is important to be friendly, be a caring physician, but are you crossing the line to being a friend? So those are the initial barriers that we know that we have. Medicine 2.0. This is just our current medical platform, if you will. It's a medical mindset that every one of our patients come in with. And it ranges from things like take a pill and I'll be fine, to even things like I'm not going to show up early for my new patient appointment because medical doctors run late. So why am I going to come early? Like, it's this whole mindset around how the medical system works. And it's a barrier because we're different. We're very different, but they don't know that, right? So it's a barrier. But what Doug laid out, and again, you can go back and check all of these details, is that patients want medicine 3.0. Is this term from the book Outlive Your Longevity or something like that. You can go look it up. But Peter Attila talks about medicine 3.0. And the idea is that this is like an industry that is exploding people are podcasts, books, products. They want this wellness. But the very foundation of this longevity movement, the very foundation is that you have to be able to move well. It's mobility. And that's where we come in, right? So one of our barriers is medicine 2.0. Society really wants 3.0, and we can give it to them, but we've got to be talking about it, right? So most people are not connecting the dots between what chiropractic is and overall health. Again, they're stuck in this mindset that chiropractic's for pain. They see pain as urgent. Anything else is optional, if you will, right? They don't see that mobility as the foundation to all of this longevity movement, wanting to be able to be mobile, wanting to be able to run marathons or kayak or whatever it is that they're wanting to do. They're not putting together the fact that chiropractic is what they need for that. So it is really our jobs to shift that perception. And yeah, it is like turning a Titanic, right? Because it is a big ship that's been going in one direction for a long time, and we're working hard to shift that. We have to reframe this idea and help them understand that mobility, movement, right? Just the idea that we can move and stay mobile is a direct correlation to what they need for staying, for having their longevity. It's lifespan versus health span, right? Are you going to live to 90 to 100, but you can't move and you're on 1,000 prescriptions? Or are you going to live to 90 or 100 and be mobile and active and having a healthy life? That's what we're here for. So the other one that is really important in our 5 barriers to wellness, and where we're going to spend the majority of our time today, is talking about this idea that we have fewer opportunities to tell them about chiropractic wellness. Because we do. We are very limited in how much time we get to share what chiropractic wellness is and how we can impact all those other pieces of health, right? Not just low back pain, not just headaches, not just mid-back pain. We have to remove these barriers, and the only way to do it is to make sure we're very specific and structured in what we do in the office. Okay, so we're going to maximize our time. In the office, we're not going to talk about weekends. We're going to talk about wellness. Just keep that little tagline in mind. Talk wellness, not weekends, right? And how do we do this? How do we stay structured and on point, focused on breaking down that barrier of not having the opportunity to talk about chiropractic wellness care? Well, the first thing we're going to do, doctors, is we're going to make sure we're communicating the value. Team, communicating the value. And the number one thing that has to happen with that is you have to have a system. You have to have a system that is built around communicating the value of chiropractic wellness care. If you find that you are only talking about pain care, then that's all your patients are going to know, think about, and refer about as well. You have to watch your words. You have to watch what we're saying and doing to make sure that we're communicating wellness care. Well, how can we do that? First thing is you've got the foundation. If you are doing the integrity system, right there, this is your chiropractic wellness foundation. Everything is geared towards leading the patient to wellness care, right? So you've got your first day video, your report of findings, all your wellness reports, living well for life, everything is guiding those patients to the wellness message. So you've got that. So you're doing the first start, the foundation. But in particular, and where we're really needing to make sure that we are sticking to this, and everybody, we can take our hats off, our halos off rather, and we can admit that we're not always the best at this. Doctors, for you, is the 6-point office visit, right? This 6-point office visit is the key to making sure that you're grasping the time to tell them about your chiropractic wellness message. When you're doing this visit after visit after visit, the patient is only maybe hearing this, 18 to 24 times through their acute care. And if they're coming even a maximum of 3 times a week, they're going to hear this message 3 times, 15 minutes. Again, then they leave and they're inundated over and over and over with the medical mindset, right? So by the time they come back in, day or two later, this is not even on their mind anymore. Yes, you say it 50 times a day, but the patient does not hear it 50 times a day. It's really important. More so, it is very important that with your 6-point office visit, you are relating it to the patient. When you are talking to them about heal, prevent, future performance, where are they at in their stage of care? Acknowledge it. What is something that you're working to prevent for them or just is going on in community at that time? I'll talk about that in a second. And future performance. What is important for that patient to stay mobile for? Relate this to them so they understand the message, right? So, hey, Miss Pamela, I'm really glad you're here today. I'm glad you had this date with my adjusting the table because I can tell that, you needed this adjustment today. Now, remember, there's 3 things we're doing with this adjustment. Every time we're removing that nerve interference to get rid of the pain. Now, we've done that. We've gotten you past the pain stage, and we're glad, and we're not going to go back there. But second, we're removing that nerve interference to prevent future sickness and pain in the first place. In fact, right now, I'm adjusting, put in your vertebrae, C3, and this is opening up the nerve pathways so that, put in whatever, XYZ can happen. Your body can tell, sinuses, allergies, whatever you're opening up. If it's L something and you're helping the gut, you tell them what you are working to prevent and saying things like, and we find our patients have less allergy symptoms to begin with in the first place. And third, we're removing that nerve interference for your future performance so you have better mobility for the rest of your life. Because I know how important it is for you to be able to get out into the garden, play with your grandkids, kayak, ride a motorcycle, whatever it is. But doctor, this is our key right here, this 6-point office visit. Keyed in on that patient, where they're at in care and what's important to them. This is the key to making sure that we're removing the barrier of time, of not having enough time to educate them on chiropractic wellness. Okay? Now, next one says staff, but this is staff and doctors as well. This is a concept of making sure we have a structure of education and being able to wrap our proxy conversations as well around a topic, if you will. So whether you call it a condition of the month, a topic of the month, maybe you do a vertebrae of the month or a vertebrae of the week, whatever you call it and however you do it. But the idea is that we're educating as a team on a set topic for a month, or maybe you do it for a week or whatever, but a month is good. Okay? So these things are a topic we're talking about. The doctor can roll it into their 6-point office visit. We'll talk through some of these. Let's look at this one in particular, team. Did you know patients who use chiropractors as a primary care physician demonstrate 85% less pharmaceutical costs? Okay, so you put this up in the office, or you put this up on social media, and it's in the office, it's in the treatment rooms, it's on your social media. Your doctor talks to you in a staff meeting about this and how does this work and why, or you go look up the article if you want. But the point is, then you have it on the board. So when patients are coming in, you say, hey, Sally, did you see our board this month? Did you see that patients who use chiropractors as a primary physician have 85% less pharmaceutical costs? And you talk about it and you ask them, who do you know needs to seek chiropractic care too? These are topics for proxy, but they're also topics for educating on chiropractic beyond pain. Okay? Or here's another one. Chiropractic first, because mobility matters, right? Did you know that choosing chiropractic care first over opioids can significantly lower your chance of ER visits, hospitalizations, surgeries, and other medical visits? And you put something like this up, again, at the front, in the treatment rooms, on social media. And when your patients are coming in, you're saying, hey, did you see our board? Did you know? And you're having this conversation over and over, month by month, on what chiropractic wellness is. That chiropractic is beyond pain, right? Or how about this? One of my favorites. If you've coached with me for any amount of time, you know how passionate I am about chiropractic, but specifically pediatric chiropractic and the connection with youth sports. So this one, you have it up on the board, you've got it on social media, you're talking about it. Did you know? Annually, high school sports injuries there's 2 million high school sports injuries with a cost between $5.4 to $19 billion. Ask us how chiropractic can change this. And you can have these conversations. Again, patients are coming in. You know if their kids play sports or not. And you can have these conversations. You can proxy for new patients. But again, the essence is that we are talking about chiropractic beyond the low back pain, headaches, and neck pain that everybody seems to think that chiropractic is for. We can start to get patients coming in like, did you know that we can help prevent these injuries? Because a lot of these injuries are knees, hips, and ankles. Well, how are those susceptible to injury? Because the child's frame is not balanced. They're not well adjusted. Therefore, improper wear and tear on one side or the other is going to lead to more injuries, right? So these kind of conversations over and over, month after month, we're talking about different topics, whatever it might be. Let's look at another one. Okay. Did you know women that fill one opioid prescription a year after childbirth had a 40% increased risk of serious opioid-related events? Now, that's a lot, and that's kind of heavy. Just so if you look at this is opioid overdose, death, addiction, but also looking at 75% of women who 75% of women fill an opioid prescription after having a C-section. And then you just ask us how chiropractic can help. And you start having these conversations. And I promise you, you're going to actually start to hear people say, you can see pregnant women? Chiropractic, what? Women can be adjusted while they're pregnant? Like, people don't know. We start to make assumptions. We start to think because, again, we've talked about this a lot, that repetition or that diminishing effect is like we just forget that people do not understand that chiropractic is beyond pain. And that, yes, it's safe and effective for pregnant women to get adjusted. Yes. And, we can't eliminate every C-section. Absolutely not. That's not going to happen. But can we change some? Yeah, we can. You have that impact of lowering the rate at which a woman has to go fill a prescription after having a C-section. You get to have an impact on that because you are keeping pregnant women well adjusted so that they can have easier births. Or maybe because we have been able to have a successful flipping of a breech baby. These are the things that people don't know. And if we're not talking about them in our offices, nobody is going to know. Nobody's out there talking about it. You don't have a TV show who's talking about these things. You don't have social media even talking about this. You have to be the ones in your office that are making sure to spread the message of chiropractic wellness care. Okay? How about this? Did you know chiropractic adjustments are safe, easy, and effective for addressing ear infections? Again, I will promise you, the majority of parents have no idea that you can adjust their children, let alone that will help things like ear infections, bedwetting, constipation, any of these things that we could just continue talking about. So we have to start having a structured system to ensure that you guys are going to be able to have a means of communicating what is chiropractic wellness care. When I say chiropractic beyond pain, what does that mean? Well, this is where you guys start to have these conversations on an ongoing, regular basis. And what a perfect time of year, as we're coming into the last quarter of the year here, to start doing your strategic planning for 2026 and start to put together your conditions or topics or whatever it is you want to talk about for the 12 months of 2026, so that you're spreading your chiropractic wellness message, right? So, communicating the value. How are we going to remove this barrier? First of all, you have to use 100% of the system, because it is built around communicating chiropractic wellness care. From the new patient video to the digital report of findings and the progress reports and the wellness report of findings now, the Living Well for Life video, and in addition, those amazing new pediatric videos, so we can educate these kiddos even more at their stage, kind of their level of where they're at. It's amazing. And doctors, you've got to utilize that 6-point office visit to bring that message consistently beyond pain. We cannot skip it. We have to take the action step. Assign it to somebody as a team, whatever you're going to do, but don't leave today and not take these action steps. Choose your topic or your condition, your did you know, your vertebrae of the month, whatever you want to do. But pick it, sit down, strategize for it, lay it out for the next year. And then, doctors, I really want to challenge you, because, again, as we assume that the public knows more than they know, we also assume our team knows more than they know. So whenever you do a topic, whether you're going to talk about allergies, you're going to talk about posture, whatever you're going to talk about, at the beginning of the month, you're going to have in your staff meeting a conversation on what your adjustment does for that topic, right? So if you're talking about allergies, you're going to talk to your team about, hey, this is how my adjustment to these vertebrae open up and impact these things, and this is where we see the relief in symptoms or whatever. You have to help educate your staff as well, okay? Don't assume that they understand. And then front desk, back rehab area, doctors, we guide our proxy conversations around these. And I'm going to challenge you to just have 2 conversations a day. If everyone in your office had 2 proxy conversations a day, your referrals would skyrocket, right? So 2 proxy conversations a day guided around your topic of the month. It's so easy, okay? And then, yes, don't forget that you guys can put these out on social media, put the posters or signs up in the office or a board in the front, Google post as well. We oftentimes forget that we can post on Google, not just on Meta or whatever. But make sure that you're sharing information. And if there's a topic that relates to some other group or profession in your community, make sure to send it out to them as well. For example, if I'm talking about ear infections or I'm talking about seasonal allergies in kids, I'm going to send an email with this information to my school nurses. They need to have this information as well. Or if I'm talking maybe about TMJ later, that's not really wellness related, but just the same kind of concept, right? I'm going to make sure I send all that information out to my dentist in my area as well. Okay, so make sure you're spreading this message of chiropractic wellness care, because chiropractic is so much more than pain care, and it goes beyond what insurance will cover, right? That's a whole nother topic, but very important to understand that just because insurance isn't going to cover that wellness adjustment and we're not going to bill insurance for it because they won't cover it, it is valuable. It is important, and it is not optional. I want to say that again. Chiropractic wellness care in our world is not optional. This is important. It is the foundation of what everybody's healthy lifestyle should include. And I'm challenging each and every one of you to really believe that and really understand that without the adjustment, we are setting our communities, our families on a path to unhealthy living. And it's time for us to change. It's time for us as a profession to step up and be willing to communicate and educate the value, the immense value of chiropractic wellness adjustments. I am so excited for what I know you guys are all going to be doing for this next year. You're going to take this message and you're going to spread it in your communities. And we're going to continue to see your wellness numbers skyrocket. It is so fun from my viewpoint as an integrity coach to watch wellness visit numbers growing month by month as it is in our clinics. It's so exciting. But I know 2026 is going to be the best yet. I thank you for your guys' time today. I welcome any questions you have. You can always reach me at PamelaJ@integritydoctors.com. You have a great rest of the conference.